I'm in my last semester of an ADN program, and I'm too afraid to ask my instructors because it's probably something I should already know. I realize looking at patient charts is a violation if they aren't assigned to you, but what if they're on the unit you work on? I've noticed my clinical instructors are constantly looking through patient charts, which obviously makes sense because they need to know which patients can be safely placed with students. However, what if you're working on your unit and you have to look up information for a patient that isn't yours? For example, what if the assigned nurse is not available and you need to see if a patient has any precautions not readily apparent? Maybe the patient needs help that cannot be postponed until the nurse comes back, but certain relevant interventions may be indicated. I'm not asking to look at their charts out of curiosity. I wouldn't risk my license over that, but out of safety for me and or the patient. I think this is a really great question, and I don't think you should be afraid to ask your instructors any questions. No matter how dumb you think the question is, I think it's probably a question that somebody else has. So you should go ahead and ask that. But I would say personally, if I'm not taking care of that patient, I wouldn't open the charts. But I have worked as a break nurse before that required me opening people's charts. And whenever I did, I would put in the notes access charts as break nurse. Put a little documentation as to why you open that chart. And I think that would be enough to cover or touch bases as to why you are opening that chart. Of course, if you're like a charge nurse, also that's different. You open all the charts. I've worked as a relief charge nurse, so a lot of the times, actually every time I work as a charge nurse, I open everybody's chart in order to make sure that I am filled in on what's happening on the unit. So, yeah, that's my take. What is your take? What do you think? Let's discuss in the comments. What would you do? If you have any stories, please send it to info@mswendolynrn.com.